This is Dr. Craig McInnes, and this is a continuation of our video blog series about veterinary cardiac ultrasound. The right side short axis M-mode measurements of the left ventricle, mitral valve, and left atrium and aorta are called Tycholz measurements. M-mode measurements tend to be more accurate because the image created is limited to the chambers and tissues in contact with the M-mode cursor, and full motion of the structures is recorded. As mentioned in the previous blog, the cursor of the right side short axis M-mode LAAO image usually crosses the left auricle and not the left atrium. In cardiac disease, the left atrium enlarges before the left auricle does. In some cases, the Tycholz M-mode LAAO measurement will not reflect early enlargement of the left atrium. Measurements of the left atrial and aortic diameters can be made from two-dimensional right side short axis left atrial aortic images. Accuracy of measurements from two-dimensional images depends on the price of the ultrasound machine, the size of the patient, depth of the image, and frame rate. Very expensive ultrasound machines, like $350,000, will have multiple motherboards and increased computer capacity to control multiple parameters, resulting in better images and more accurate measurements. Less expensive ultrasound machines, like $30,000 to $60,000, tend to have one motherboard that controls all parameters and has a more limited computer capacity. In this 14-pound poodle, depth is 8.5 centimeters and the frame rate is 89. Deeper depth and a larger two-dimensional image requires increased computer capacity. Ultrasound machines with a single motherboard may have to sacrifice frame rate and image quality in compensation for creating a two-dimensional image in a larger patient. In this 45-pound Basset Hound, depth is 11 centimeters, and the frame rate is reduced to 38. A reduced frame rate may not capture full diastole or full systole for measurement purposes. In spite of this trade-off, a two-dimensional LAAO ratio may give a more accurate representation of left atrial enlargement than the Tycholz M-mode LAAO ratio. The Rishnu or Swedish methods of two-dimensional LAAO ratio calculation can be used. In both of these methods, measurements of the left atrium and aorta are made from a still image of the two-dimensional LAAO view while the aortic valve is closed, 1 or 2 frames before the aortic valve opens. At this point, the aortic valve root is at its maximum diameter, while the left atrium is at its minimum diameter. In both methods, the left atrium is measured from a point where the non-coronary and left coronary leaflets intersect, and the line extends across the left atrium from the intersection of these leaflets. In the Richelieu method, the aortic diameter is measured from top to bottom in a line that extends from the intersection of the non-coronary and right coronary leaflets. In the Swedish method, the aortic diameter is measured from a line that extends along the intersection of the non-coronary and left coronary leaflets. This line is actually a continuation of the left atrial line of measurement. Left atrial diameter is divided by aortic diameter for a ratio. In the Richelieu method, the normal ratio for a dog is 0.8 to 1.6, and the normal ratio for a cat is 0.88 to 1.79. In the Swedish method, the normal ratio for a dog is 0.9 to 1.3, and there is no normal ratios determined for cats.